One of the most dangerous mistakes in urgent care is either ignoring abnormal vital signs or overreacting to them. You're in P-Pal here. Welcome to another lesson from the track. So today's segment I want to call abnormal vital signs, when to discharge versus when to treat. All right, so when I worked in the emergency room, we had a policy that they didn't want you discharging patients if the heart rate was over 100. So even if they came in there for some ortho complaint, they were sick, or whatever it was, their final discharge, if they were over 100, you have to do something about it. So in that setting, you have the luxury of starting the IV and giving fluids. Most of the times that would take care of it. If it was still high, then you escalated and did something else. The thing with urgent care is that you don't have that luxury. And there's also no clear rules or guidelines to tell you what to do. So you're kind of stuck with this problem. And it's something that is very common. I know y'all see it all the time. I see it a few times a week. So definitely want to talk about that today, okay? This is very important, so make sure you listen. So the first vital sign I want to talk about is the temperature, but not just the temperature itself, but how it can affect the heart rate, because that's one of the most common things that we see, especially during cold and flu season. Right now it's March of 2026, so we're getting to the end of that, but that's the majority of what you see, during probably October to about March. These really sick patients, especially with flu. Flu really always kind of take people out, run really high temperature and can affect the other vital signs, okay? So a general rule is that for every 1 degree Celsius, the temperature goes up, the heart rate can go up about 5 to 10 points, okay? So somebody, 101, 100, they can go up till about 110. Even somebody at 102, 103, they can get up till about 120, 130. So you expect to see a high heart rate when the temperature is high, okay? So what you don't want to do is have somebody who is afebrile or they're like 99 and they're sitting at 140. Because that would be something that's alarming and concerning, okay? So I remember I had this patient, she had flu in her mind when she came in. She was like, oh yeah, my husband's flu positive, I feel achy. And came in, and flu, COVID, strep, everything was negative, and her heart rate was 140. And I was just looking at her, and I was like, well, you tested negative. And she was like, yeah. And so I started to ask more questions. I was like, well, what other symptoms do you have? And she didn't really have much. She was like, yeah, my back was hurting a little bit the other day, but she was like, I just feel achy. And she looked like she didn't feel well. She didn't have the flu look where, you walk in the room and she's laid out, very lethargic. She didn't look like that, but she didn't look all the way right. And she didn't have chest pain, she wasn't short of breath. Even though her heart rate was beating fast, she didn't complain of any palpitation. So I wanted to just check for another source of infection first. So I just had them run a urine. It was crazy. She had a really bad UTI. Nitrites, she had blood, leukocytes. And so just from that, and the fact that she was already feeling achy and febrile, you really start thinking, is this pyelo? You know what I mean? So definitely just kind of adds to the differential things, but there's certain vitals, certain numbers that just don't fit, okay? So don't just lock onto the number. Also look at the patient too. And also, make sure you recheck the vitals, okay? Especially when they're high, because not all techs/MAs, whatever y'all call them, wherever you work, they're not created equal. And I know y'all know what I'm talking about, okay? You have the ones that are just too smart for their own good and they know everything, and the ones that they're just a body in scrubs, okay? It's like they'll check a blood pressure, it's 72/30, and they don't even tell you. Just last week, I had a patient, her blood pressure was 88/52. And I asked her, I was like, hey, did you recheck that? And she's like, no, she's 22. What does that mean? That's not normal for a 22-year-old. So that's the first thing I do. So when I see, even before I go into the room, I look at the vitals and I'm like, okay, are these accurate? And then also, does this match the patient? And I'm not too good to recheck vitals. I know I've known some providers over the years, they get to this level and, oh, that's beneath me taking vital signs. The thing is, nurse is still our first name. So you don't stop being a nurse just because you're an NP, you're at this level now. So, especially depending on who you're working with. Like, if your tech is kind of iffy, sketchy, they don't really, even if they're not, I'm still gonna recheck it myself, okay? Because the most common one is that heart rate. So I like to go in there and let's put the pulse ox on, let me talk to them, let me get some more information first. I'll confirm with the apical pulse as well, okay? So you also definitely confirm yourself, okay? So the first thing you wanna do is recheck those vitals, okay? So if they're febrile, like I mentioned, that can run the heart rate up, okay? So I don't get too excited with those. Now, even with the number, do you have to do something about it? Again, it depends on the situation. I mean, if you have somebody that they are positive for flu, they have they have strep, something that explains it. Not necessarily. It's especially if it's over 100, but not greater than 120. Now, a lot of times that's from the fever, okay? So, and I know just the patients I take care of nowadays, it's like they don't want to be treated there. They're like, oh no, I have that at home. Now, I don't know if they're gonna get a bill for whatever, or they think they're gonna get a bill, but a lot of them will, refuse treatment of the temperature, which I totally understand, okay? Like, I don't force them. I'll just offer them, hey, we do have a Tylenol ibuprofen here if you want me to treat the fever. If not, you can do it when you get home. All right, cool. Just document that and keep it moving, okay? All right, so that's pretty much it for temperature. So just remember, for every 1 degree Celsius, the heart rate can go up anywhere between 5 to 10 points, okay? And if they're not febrile and they're sitting at 130, 140, look for another source of infection. If not, do an EKG, okay? At least just to kind of get that out the way. Don't just downplay and act like it's nothing, all right? So that's pretty much it for the temperature. Now, the most common one we see is blood pressure, okay? So I have a separate video when I'm talking about white coat syndrome and the whole blood pressure and how that's overly used as an excuse. So blood pressure is one of the most common things that we see as far as elevated in the urgent care, okay? And a lot of times these patients are asymptomatic. However, what I've seen over the years is that providers will get basic labs, right? So I get it. I understand that you want to do something, especially if they have no history. This is the first time it's ever been checked and it's like 175 over 112, okay? They have never seen that number before. There's no history of them going anywhere. They don't have a doctor, right? That's usually the first thought that pops into your mind. But, like I always say, what are you actually looking for? Okay? So I know the thought is in organ damage. So, okay, that makes sense. However, if they have in organ damage, they're usually gonna have some other symptom with that, okay? So when you think in organ damage, think brain, think heart, think lungs, think kidneys, and think vision, okay? Something else is going to be going on if they're actually in organ damage, okay? If they have that problem. So they're usually going to have some kind of symptom. Now, even with symptoms, they'll try to explain them away, like, oh yeah, I have a little heart fluttering, but I've been stressed, or oh yeah, my headache, yeah, I've been having headaches the last. So like they will explain away as far as what they think is going on, but don't tell me how you feel, but you might have to ask the specific questions, and then not just have you had headaches, have you been having chest pain, how do you feel right now in this moment? Because a lot of these people, they're gonna be asymptomatic. So when you're considering is this just elevated blood pressure, it's just untreated hypertension versus a hypertensive emergency. So hypertensive emergency is elevated blood pressure with symptoms, okay? So just because they are 180 over 100, if they're asymptomatic, which a lot of these people are, you don't necessarily have to do anything there. You don't have to get labs. Now the labs help us feel better as providers because we feel like we're doing something, but what is it actually going to tell you? A CMP, electrolytes, kidneys, liver. Now, okay, the creatinine, yeah, that can give you some information, but again, if they truly have some kind of kidney damage, look at your assessment. Look at their legs, look at their feet. Do they have any swelling? Now, again, it's different if they have symptoms. Now, again, most patients are poor historians. They don't come out and just tell you, they'll just give you random things. You have to be in charge, you have to be in control, so you have to ask the specific questions. A lot of times they, oh, I didn't think of that. But honestly, it's not their job to think about it, it's ours, okay? So, when you see those high pressures, definitely ask more questions, get a more thorough history, and do a more thorough exam, okay? But a lot of these people, they're gonna look totally fine and they're gonna feel fine, okay? Now, there are some cases where you have like the 190, the 200 plus. I remember I had this lady, she was, I don't remember how old she was, between 70 and 80. She was in there probably for a sore throat. It was something totally unrelated. And her pressure was over 200 systolic. No history, never been diagnosed, didn't even have a PCP because she was so healthy. And yeah, she looked fine. Her exam was normal. But she just had this crazy high blood pressure. So I remember just calling the medical director and I was like, hey, I have this elderly patient. She's over 200. I've checked her 3 times, blah, blah, blah. He's like, well, just put her on metoprolol, have her come back in a week. Now, I'm not saying that's what you do. I'm just saying like that was how that doctor wanted us to handle that current situation, okay? So even with anxiety, right? And again, I'll talk about this in my white coat video, but stress can run it up 5 to 15 points, okay? So again, they're always gonna have a reason as to why it's high. I've been this, and this, or I haven't been taking my medicine, or I've been feeling okay. Just all that noise, just ignore that, okay? So if somebody is sitting at 160, 170, and they've never been diagnosed, they don't have a PCP, that is not a stress, anxiety, blood pressure. So I will start the conversation like, hey, what I can do is I can give you a referral for a PCP. In the meantime, if you want me to start you on something, I will, because it's more dangerous to just have these people walking around. And then even when you give them a list, even when you do the referral, you know how these primary care places are. Like, they may be 3-4 weeks out, sometimes even longer. That's why they come to us in the first place in the urgent care, because they can't get into their doctor. So, especially for a new patient, like my current doctor right now, I needed to see her today and I can't get in until like another 3 weeks. And that's me as an established patient. So if they already have high blood pressure, again, it's beyond the normal, like I'm okay. I feel comfortable starting patients on something, okay? You can start low dose, you know, you can do amlodipine, you can do lisinopril, depending on the person. But just kind of gauge it, okay? So don't just focus just on the number. Look at the entire situation, okay? And are they like a trustworthy person, somebody that will actually go out and do something about this? And like I mentioned before in a separate video, some urgent care is actually like kind of, I don't say want you, but if it's like a private place, they're kind of okay with, you know, you kind of starting primary care type thing. So just make sure you know the policy of your facility, because this is something that I know my company that I work for right now, they want us to definitely start addressing just these patients that are undiagnosed with hypertension, okay? Because this is probably one of the most common abnormal vital signs that you're gonna see. So, so you can start them on something if you feel comfortable. If the number looks right, but now these are just in asymptomatic patients. If they have high blood pressure and they have symptoms, they need to go. They need to go to the hospital, most definitely, okay? Same thing with heart rate. If you're sitting at 140 and there's no other reason why, like 140 is high and it's not coming down, especially anything above that, no. Because they will oh, I have anxiety. Oh, tell that to them, okay? But right now, you are going to the hospital. So I don't want you to freak out over every time, but if not just the number again, that always recheck vital signs yourself. That's just make that a rule of thumb if you don't already do it, okay? So I recheck it, look at the symptoms, and look at the entire picture, okay? So just to take away, for the temperature, every 1 degree Celsius can go up to 10 points. For tachycardia, do they have any other symptoms with it? Any signs of infection? Have you tried to rule everything out that you can there? And then for the blood pressure, any history? Are they on medication? Do they have a doctor? Do they have any signs of in-organ damage? Okay, so brain, heart, lungs, kidneys, and vision. Those are the things that you're looking for. Definitely check for pedal edema and things like that, okay? If you see something like that, they need to go to the hospital. But a lot of these patients, even sitting at 200, they're asymptomatic. And I'm gonna be more on the cautious side. I'm probably gonna start that person on something and have them come back, because you can give them a 30-day supply, okay? You can tell them you need to go see somebody, because I've seen some providers, they only give like 7 days. The thing is, there's no like rule, right? I mean, I don't give 90 days out, but I know how long the process is for trying to get an appointment. So, and I've been doing 30-day supplies since I've been practicing, and it's been almost a decade now. And nobody has come, I haven't gotten any letters or any complaints from anybody that said that that's wrong, okay? Because I know some providers, they're just, I want to do it 7 days. Like, that's a personal thing that people do for whatever reason, okay? But give them 30 days. It's not going to hurt you. Just click 30 instead of 7. Like, I'd rather them have too much than, not have enough. Because you already know, like, a brand new patient, like, they're not going to get into a PCP within 1 week. I highly, highly doubt that with the shortage of patients having PCPs right now, okay? All right, so remember, make sure that the clinical picture matches the patient, okay? So don't just chase the number, look at the patient. Get the history and do a very good exam to make sure, okay? All right, you're on PPAL here. Another lesson from the track, and I will see you on the next one.